Hello friends, welcome back to my channel Medicine of 101. Today we'll talk about atrial arrhythmia. Okay, so before starting the video, let me tell you I have already uploaded the video where I did talk about the normal cardiac arrhythmia in terms of the normal pathophysiology, the different types of the mechanisms, okay, and different types of the treatment. After that, I did upload the video based on the sinus arrhythmia. There is a total separate video where we will get about only the sinus arrhythmia. Okay. Now today we'll talk about atrial arrhythmia. So before starting the atrial arrhythmia, let's draw the heart over here. So yes, I'm drawing with it. As you know, we'll get this the fibrous annulus part over here and septal part over here. Okay, now see, we know that we'll get this, and for example over here for it we've got different kinds of the manifestations. Now we'll talk about atrial arrhythmia. Now see, when you were talking the terms arrhythmia, definitely the what we can say the heart rate, that would be what I have already said in the first video, that when you were talking in terms of the atria, for example, if I just classify normal heart rate, how much? The normal heart rate is around 60 to 100 beats per minute. Okay, 60 to 100 beats per minute. Now if we get in this way, for example, let's draw it over here. I'm just taking, this is 60 beats per minute and it's around 100 beats per minute. 100 beats per minute. I'm taking separates, okay, 100 to, okay, let's do it in this way. Now in this phase, I mean in this way, if we just compare that what from 60 to 100, this is the normal, okay. But if we get the beats more than 100, for example, if we get around 125 beats per minute to, for example, I'm just taking in terms of here, let's make it a large, I'm just taking 250 beats per minute. So from 120 beats per minute to 250 beats per minute, this thing is considered as what? This thing is considered as simple tachyarrhythmia. Simple tachyarrhythmia. Okay. Now, whatever thing we'll get after that, if we get more than 200 beats per minute, for example, we are getting in between 200 beats and 350 beats per minute. We are getting in between 250, more than 250 and less than 300 beats per minute. This thing we can consider in terms of atrial flutter. Atrial flutter. Okay, and more than 300 beats per minute, if we get more than 300 beats per minute, definitely we know what that will be regarded as atrial fibrillation. Atrial fibrillation. Okay, now we'll try to represent each of the things or the phenomena in terms of the atrial arrhythmia in terms of the ECG. Okay, now for that thing, okay, let's draw. Well, let's talk about further simple tachyarrhythmia. Okay, then for that thing, definitely when you are talking in terms of the more beats per minute or within the atrium, so within the atrium, whenever the atrials, whenever the atrial functions will see, definitely whenever the atrium, that will go under the contractions, or we can say that whenever we get the depolarizations of the atrium, at that time we can get what? The productions of the P wave. So in these cases, whenever the atrial contraction is getting more, or you can say the beats is increasing over here, definitely we will get what? The multiple P waves. Because if I show you over here, in terms of the first one, the simple tachyarrhythmia, here we will get, before that, let's draw the normal ECG pattern. Normal ECG pattern, if we just draw over here, we will get P wave, we get QRS complex. Okay, we get T wave, again we will get P wave in this way. Okay, now when we are talking in terms of the simple tachyarrhythmia, this way, so definitely the what we will get the more contractions of the atrium, so definitely we are supposed to get the more number of the P wave. So in these cases we will get, okay, let's draw in this way. In these cases we will get will recognize multiple POF. For example, we are getting 3 POF, and one of the POF that will go under the what? That will go under the AV node. That means that will contract, that will just do the depolarizations of the AV node. Again we will get the QRS complex. Again we will get the TOF. Again we will get POF, for example. Again on POF that will come under the atrial AV nodal depolarizations, and it will just form the QRS complex. Again we will get TOF. After that again we will get the OL recognized POF, and one of the POF that will come under the depolarizations. Again we will get TOF. Again we will start, we will just, these things that will be repeated again and again. Okay, so in this case, see what type of thing we are getting in the simple tachyarrhythmia. Simple tachyarrhythmia, where in the atrial arrhythmia, simple tachyarrhythmia. In this case, what type of thing we are getting over here in simple atrial tachyarrhythmia. In these cases, we are getting that the multiple POFs will recognize multiple POF. Now see, one of the POF that will go under the depolarizations, that will cause the depolarization of the AV node. Okay, that will come from here, and that will cause the depolarization of the AV node. Okay. Now let's talk about the second one. Second one, where I did talk about what? The flutter. So atrial flutter, whatever thing we'll get in terms of the atrial flutter. See, in these cases the beats is more than 250 per minute. So you can imagine that whenever I'm talking in terms of the beats 200, more than 250, 50 beats per minute, definitely the atrial contraction, that will be so severe, that will be so rapid contraction, atrial contraction. So we'll see the rapid atrial contractions. Now in these cases we'll get the POF also. So let's draw over here. So atrial flutter. So atrial flutter. Whatever thing we'll get in these cases, we'll get the POF. The normal thing, we'll get the POF sharp tooth like, okay, just like this. And one of the POF that will come under the what? Depolarizations, that will form the what? QRS complex. Again we'll get POF. Again we'll get sharp tooth like the POF. Again we'll get the QRS complex. Again we'll get the TOF. Again we'll get POF. Okay, and again on POF that will go under the depolarizations, that will cause the depolarization of the AV node. Again we will get TOF in this way. Okay. Now see, in terms of the atrial flutter, we will get this POF. This looking like what? In this case is the POF. They're looking like the sharp teeth. Just like this. Okay, figure will get over here. And in these cases, there will be much more contraction, so you will get the severe contraction of the atrium over here. That's why these POFs are not recognizable. Because of what we are getting, the frequently we are getting the frequent contractions of the atrium. As a result, we will get this type of the figure. Now this type of thing is known as F wave. This type of the thing is known as F wave. If flutter atrial, in case of the atrial flutter, we will get F wave over here. Okay, in these cases we will get the F wave. Okay, now we'll talk about what type of thing we'll get in terms of the atrial fibrillations. So see, the problem in atrial fibrillations, here we are getting the more than 300 beats per minute. That definitely what will not be able to see the well recognized POF, will not be able to also see to the this type of the wave. Definitely we'll get whatever thing. In these cases, let's write it over here in terms of the atrial fibrillation. We'll get the very little fluctuations in the normal. We'll get the very little fluctuations of the wave. We'll get the very little fluctuations of the POF in this case. Okay, very little fluctuations, and one of the POF that will go under the depolarizations. The depolarizations of the AV node over here. Then again we'll get TOF. Again we'll get this type of the POF. Okay. Again we'll get TOF. Then we'll get in this way. Again we'll get and that will continue. Okay. Now see, in case of the atrial fibrillations, we will get this type of problem where we will not be able to see the well recognized POF, rather we will get the little fluctuations of the POF, and in these cases the figure that will be seen in this way. So that is for the what, atrial fibrillations. Now the problem is over here, see that whenever you are talking in terms of these things, definitely try to understand in terms of the atrial fibrillations. In these times, we will see there will be multiple foci within the atrium. There will be multiple foci within the atriums, and from each of the foci, we will see there will be productions of the random vectors. We will get this type of the vector, this type of the vectors, and we will get the random vector productions. Okay, we will get multiple vectors, the different directions. We will get multiple vectors. Okay, in this case, we will get what, the multiple vectors in different direction from multiple foci of the atrium, that will be produced from the multiple foci of the atrium. Okay, in these cases we will get this type of thing. And think about one thing over here, that when you are talking in terms of atrial flutter, in cases, for example, we will get in this figure. Okay, that will just produce, there will be also see what the severe contractions of the atrium. Now, what are the complications we can get? For example, let's draw it once more here. That let's draw a little bit large. Okay. Now see, whenever we are getting the atrial, okay, tachyarrhythmia. Now there is a chances that whatever the beats per minute that will be produced over here, there is chances for the transmissions of the electric impulse, or the cardiac impulse, from what? From the atrium to the AV node, from here to the AV node, because these parts, other than the AV node, other parts over here, the fibrous part, there is the electrically insulated. They are electrically insulated over here, so you can see this part will work as the electrical insulator. Now see the other parts, I mean in terms of try to understand the AV node. So normally we know, what do we know, that AV node that works slowly. Okay, so we can say the conductions within the AV node, normally we know slow. But whenever we are getting in terms of the atrial, try to understand atrial fibrillations, there is chances for the transmissions of the cardiac impulse from the atrium to within the through the AV node. Whenever they will be able to cross the AV node, that will come to within the ventricle. So try to understand. Let me repeat once again. Whenever we are talking in terms of the atrial fibrillations, in atrial fibrillations we are getting the productions of the multiple vectors, the card that will put that is producing the multiple cardiac impulse. Now in these cases, whenever there is a chances for the cardiac impulse, if they can cross the AV node anyhow, whenever they will come within the ventricles, they will cause the ventricular arrhythmia. So whenever the cardiac impulse that will be able to come from the atriums via the AV node to the ventricle, they can cause the ventricular arrhythmia. And whenever the ventricular arrhythmia, we will see that is the life-threatening situation. So that's the most worst thing over here. We'll see that's why if we can make one thing, we can make in terms of the treatment. We can do. We can just do the terminations. We can do terminate. Right. Let's say it will terminate the atrial. Okay. Tachyarrhythmia. The second thing we can do, we can just we can make the AV node slow. We can make the AV node more slower. As a result, whatever the impulse will come over here, that will be just held. That will be held over here for for a while. After that, the impulses that will go. Whenever after reach the atrium, that will be empty. That means the contraction will be done. After that, the electrical impulse, the cardiac impulse, that will be sent from the AV node to the rest of the part, I mean within the ventricular myocardial cells. So for these things, there are some certain types of the drugs. So there are certain types of the drugs, okay, that can make the AV node slower. Okay. Now what type of the drugs in this way? You can use the calcium channel blocker. Within the calcium channel blocker, we can use the verapamil. Okay. We can use the beta blocker. We can use the digitalis also. Okay. Okay. Let me see these things once again. Digitalis. Now what do we know? The digitalis that use basically for congestive heart failure, right? We know all of these things about the digitalis. They use for congestive heart failure. But these digitalis, they can also be used for atrial fibrillation. In these cases, we can use in these cases to make the AV node slower. We can use the digitalis because this digitalis is having the what? Vagal tone effect. They can increase the vagal tone, and whenever the vagal tone that will be increased, definitely what? The heart rate that will be slow. So the digitalis, they are used for congestive heart failure. Along with that, this digitalis they can also use as what? The vagal tone stimulator. So whenever the digitalis is stimulating the vagal tone, as a result, what? Whenever the vagus nerve that will be stimulated, definitely that will do what? That will just do the, that will reduce the heart rate over here. So whenever the heart rate will be slow, definitely, within the AV node, the electric impulse that will be held for a while. After that, it will be transferred to the ventricles. Okay. So we can use the calcium channel blocker, we can use the beta blocker, we can use the digitalis also. So this type of the drugs we can use as far as the atrial arrhythmia is concerned. In the next part of the video, we'll talk about the nodal arrhythmia. In terms of the nodal arrhythmia. Okay, or you can say the junctional arrhythmia over here. So that's all for atrial arrhythmia. If you think this video is good, please do like and subscribe my channel. And see you in the next video soon. Thanks for watching.